promotive healthcare is also another avenue that we really need to explore more, because from the age of a child, we have a lot of families led by children, or people who have grown into leading these households. We need to make sure that even our education system speaks to this. And that's why we're really trying to advocate for a multi-sectoral approach as Uganda, to say that health is not just the gamut of health, Ministry of Health. Ministry of Education has a role. Ministry of Works has a role. I know a lot of people here have been using boda bodas, the bikes, to zoom around, but the bulk of accidents in this country are coming from bikes because of the simple fact they don't understand that you shouldn't drive the wrong way on a highway. So we need to really make sure that we emphasize the importance of a multi-sectoral approach as the solution to a lot of the health challenges we have, because we don't have a lot of money in the country. From most of our population is under the age of 18, 50%. So the taxpayers are very, very few. So we have a limited basket from which to pick the money. So in order to address that, preventative healthcare, promotive healthcare, and making sure that we use a multi-sectoral approach and those resources in the other sectors to support the health system.
Thank you very much. Danny, still in relation to the same, and looking at the push and pull factors that could enable PPPs flourish or even start in some of the countries where they haven't started. How do we better on that front for governments? Because like Grace earlier on discussed, whereas I'm putting in the money, I loved when I think Dr. Vita talked about the medical equipment scheme that is happening. You will go to some of these health centers or health facilities, public or private, and that could be one of the challenge. And that's something that PPPs could be able to address, but the incentives, the concessions the government has to be able to take, how do we better those to attract more and more investment into primary healthcare?
Yeah, I think, and we heard so many good interventions earlier. There is no public without private. There is no private without public. And I think sometimes, even in Rwanda, you have public sector agents, officers, or people who will tell you, in different ways how they value the private sector. They really say it with so many nice words. We actually also heard it this morning.
But the action is different.
And we feel really loved. But then when it comes to the actual doing, we start seeing challenges, and they say yes, but so when it comes to really getting things done, it becomes challenging even from the public sector to really, I don't know whether it's a trust issue, but involve the private sector. An example is COVID. The private sector was really getting geared. I was seeing in our discussions with the federations how the private people were getting prepared from different angles, the hospitals, the clinics, the pharmacies, etc. I remember I sit on the board of the Rwanda Biomedical Center, which is the arm by excellence that implements the Ministry of Health activities. And I was telling them, you have about 700 private pharmacies ready to provide assistance, simply by just giving the right piece of advice, to people who come to the pharmacy. You could ask the pharmacies to just print out infographics. I remember with the Uganda Healthcare Federation, we did something with the AERC, and we're talking about infographics. We do that. We take those initiatives. But sometimes the public sector sometimes thinks if the private sector takes some initiative, there must be money behind it. There's an expectation somewhere where the government will come and pay, or the population will pay. Most of the time, it's not. It's just part of our daily routines, our job, and sometimes we want to incorporate what we do best, what we understand best, to the government priorities. So we tell the government, we tell the public sector, use us for your priorities. Don't call for us and say, listen, we need you here only. because you could call us and say, we need you here, and we're able, but at some point you may say, come and we need you here, when we have not received the right support. You know, we talked about trainings, we talked about informations. I read this morning, I was invited in a meeting, and I'm like, okay, what is this meeting? And it's public-private partnership. But there is something that has been prepared, and that's something we discussed with, for instance, the Rwanda Food and Drug Authority. They will invite the private sector, and they'll say, oh, this is part of your engagement. This is part of our discussions. But they will come with a concept note and documents that are fully done, and they ask for your signing in, your buying, basically. And you're like, but we should have been part of the whole concept note writing and ideas sharing up to this level of signing, where we actually are part of it.
Interesting realities there, that if the private players are coming in, and yeah, there is some money behind. I totally agree with you. I would kindly request to have just to be able to allow us to move in quite quickly, and we could be able to just put up your hand if you have a comment or suggestion as we get into this. But as we get that microphone, I'd like us to speak to issues of technology and how that is going. We can leverage on technology to promote primary health care. But then comes in the issue of uptake, reach also, as well as much as it may be very, very important, but also issues of distortion of information, and also key amongst those aspects of privacy of information, privacy of the user of that particular technological advancement, as we get to promote primary healthcare. And Danny, I want to start off with this. How do we look at all those aspects as we continue to look at technology as the now? I normally don't like to say next big thing, but the now big thing, because we are looking towards the fourth industrial revolution.
I was really honored to moderate a session on innovation and technology. And what I can see is that there are ideas, there are technologies, and through COVID, we really saw how some of these applications were very helpful. For instance, in Rwanda, there is a company that is called From Babylon, and it's basically telemedicine. And it was very extremely useful because before COVID, right before COVID, they had signed an agreement with CBHI, with Community-Based Health Insurance. So you had that remote access by everyone for a very small fee that was reimbursed by CBHI. That's one example. But it was also I would say policing from the police during COVID, where they would send drones and check on people. And this is coming from a private company, and they said they would send drones and then later, inform people that they know that you were seated and you were more than 50 people or more than 25, depending upon the regulations. So you have all. You have the private sector really coming up with all sorts of solutions, and some of them were really ahead of time, and that's why I said earlier that we're really able to leapfrog with these solutions. I think one of the key elements, and that was also talked about during this conference, is the laws with that, and how the public accepts or incorporates the use of these applications to help strengthen our healthcare systems. So yeah, I believe that a lot is going to happen. When you see now the listening ear on the government side, and the level of adopting what is being done, but also the role of social media and media in general, to disseminate the kind of success that you see in different parts of the world, and the world has become even more connected. So yeah, change is coming.
I think change is here. It already came. And Grace, just before we go to the audience, I'd like you to speak to the technological advancement, but also being very, very careful of the distortions that could come. For example, social media, very important, but the disinformation, the misinformation, distortion, basically, that could happen.
Yes, actually, it's interesting when you mention social media, because some of the challenges we've even been facing with Ebola is the misinformation in Uganda around what is happening. It moves way faster than fact. And one of the things that we also need to remember is, like I said, the multi-sectoral approach, the cost of data, the infrastructure to access that data. A lot of us are relying on very expensive internet to be able to operate our facilities, but also for people to talk to each other. The cost of electricity, the cost of the actual gadgets. So when you look at the entire chain that people have to interface with to be able to access data, to talk to each other, to digitize, even to digitize their health business, the cost is very high, not only in terms of even reliability of this connectivity. So yes, we welcome the whole digitization of our lives, but we also need to be mindful of irresponsible use of these very tools. How do we educate populations to use these tools wisely so that we don't suffer as much as we are right now, because they're exploited for likes and tweets and retweets and all of that. So that's something that we also need to look at, the good and the bad of having digital tools as part of our lives.
Thank you, Grace and Danny. I'll take you to the audience for just a few before we get our parting shots here, but we can also continue with that discussion at www.menti.com. Continue if you didn't have to go through this. One or two in the audience, you can just raise your hand. Yeah, right there. Feel free to let us know your name.
Thank you. My name is Edward Kalisola from Access Dental Care. Technology is both a benefit and a disadvantage. Currently, because of easily accessible information on the web, almost every person has become a medical profession. They go Google symptoms. Once they have a headache, they go Google headache. It brings out all sorts of causes of headache. Someone walks to you and says, "Doctor, I think I have this." Then you're like, "Who told you have that?" I read somewhere and says ABCD, and I think I have all these symptoms. So in an area where access to healthcare may not be readily accessible because of cost, I think we run a risk of exacerbating our problem rather than finding easy solutions, unless we play around very carefully with the technology, whereby we inform the public that yes, you can Google symptoms, but you need to get professional advice. Otherwise, we may miss out on the benefits of this. Thank you.
Thank you, Dr. Edward. I think it's totally true. There is Google, but there is a doctor who studied as well. So you need to respect that professionalism. Do we have another comment or supplement to the discussion that we are having? Could take just one or two more, and then we get to conclude. Yes, there is a hand emerging.
Thank you very much. I've enjoyed the discussions this afternoon. My name is Bernard Olayo. I'm with the World Bank. I think what I've found very interesting is just the missing voice of the money people. Because when we talk of PPPs, you have the public and you have the private, but generally you need investors. Now the investment space is very rapidly changing. East Africa is becoming the hub for most of the new funds because we have extremely good returns. So I'm hoping that once we sort out our conversations with the government, we can start having these funds around the table to talk to our service providers so that we can get to understand what they're looking for before they can invest in some of our businesses.
Thank you very much. Just one last chance. Yes, there is a lady at the back. Yes, please.
Yes. just say something that medical personnel or health workers shy of saying that they're working for profit. I'm telling you, as such as we are private, not for profit, we are not also for loss. This should come out clearly, and I think this comes from the background at which they are told. Actually, they are requested or asked to swear that they will never take money for services, which is different now because the world has moved on. That used to be long ago. Now we need to change all these policies, and some of these things they still remain. That's why we are being affected. So we need to change some of these things, and I'm telling you that as much as we are not for profit, we are also not for loss, because we have to maintain these services and they have to move on, and the services have to continue. There's no way we can keep hiding under there. I'm telling you, if we do not merge and make a budget together with the government, let's plan together strategically, make a budget together and see how we divide this meat to make services better for the public people, for everyone actually benefit. Thank you very much, Mr. President.
Thank you very much. Okay. All right, we'll take just one more and we get back to the panel and we'll finish up this. Since it's not private for profit and not private for loss, I think it should be private for sustainability at least. Let's be sustainable in all that we do. Yes, please.
Thank you so much, Chair. I think in relation to that, my name is Robert Mugira. I work with the Ministry of Health. I think the call to action is, what is our contribution to the table? As we talk about public-private partnership, it takes two to tango. As the Healthcare Federation, when we get to the table, what is our contribution in terms of what we are bringing to the table? For example, we are talking about case management, managing of cases. You had the permanent secretary told us that we contribute 40% of the total cases that are managed in Uganda. Is that the true case? Do we ever share our information with government, so that we can plan together? I think my question or my point of discussion, Madam Chair, it is around our reporting, integrating it into the government structure so that they can clearly see what our contribution is. For immunization, in most of the cases, private sectors helped to keep the immunization coverage high up there, but do we come out to say this is what we are contributing, so we deserve this part of the cake? Thank you.
All right, thank you very much, Robert. And because of time, I think we'll just cut it at that. There are more conversations that will continue on our online platforms. Let me just get back to our panel as we get to wrap up this. And Danny, I would like to start off with you on one, the aspect of the regulatory framework in promoting public-private partnerships, especially when you mentioned that they will give flowery, messages and heartwarming messages, but the action becomes the harder one, as you also give some recommendations in your parting shots.
I recently, before coming here, when we were trying to get, the team, from the public and the private here in Uganda, from Rwanda, and the team in the Ministry of Health told me that they have the Rwanda Development Board that is facilitating now these discussions. So I think, and this is something that I've seen probably in different countries, we in our laws, we really developed them from the EAC laws, which were developed from Uganda and Kenya and Tanzania mainly. So I think that Rwanda is really good at implementation. Now we really have, as the private sector, to position ourselves. The Rwanda Healthcare Federation is a rather young federation, and again, emerging from the sister federation, Uganda, Kenya, and Tanzania. But to echo what Dawit was saying, there is a lot that we need to do to also let the public know. Sometimes we feel like they know, but I want to believe that we don't speak the language that they want to hear. Maybe we need to write it down the way they will understand it best, putting in papers that are going to be submitted in this and that office. I think that from the discussion with the ministry officials, I understood that there's a certain way we as private sector have to do things, and that's not the first time. That's probably the second or the third time that they kind of reminded us, and they said, listen, there's a way we even address the public sector. You know, the private sector, we're into, yes, you know, there is the business aspect. So we take things a bit our way, but there is also a certain way that the public sector does, and we just need to abide by that. If they want articles, they want us to put things in writing, they want us to publish. Yeah, we just have to do that at some point.
All right, thank you very much, Danny. Grace, you'll have the time to speak about the regulatory framework, but also some recommendations and takeaway that we need.
Okay, so for Uganda, we have a PPP Act. We also have PPP regulations. For health in particular, we have a PPP strategy that we're working towards updating with support from strengthening supply chain systems. They've said they're going to come in and help us improve that. We also have policies around making sure that we understand how to talk to each other through a technical working group that meets every month that we co-chair with the Ministry of Health. So the conversations happen, and we have a platform to showcase our challenges and to make sure that they move through the ranks of or the tiers of the Ministry of Health to be heard. But as Danny mentioned, at times it can be lip service. We can't get away from that. I think, as the PS said, much as at the top end, maybe we have buy-in, we have a decentralized system. So at the grassroots, they may not be buy-in. So when you go to a district, you'll find a district health team is saying, but I'm not facilitated to support the private sector. There's no PPP desk. So that disconnect is what limits our ability to actualize PPPs from a grassroots level. And it's also really mindset. I think we have the mindset that government should be able to provide everything. And when you engage civil society, they say, but health is a public good. The government should provide everything. So to get the mindset of no, private sector, it's okay for private sector to complement. It's okay for private sector supplement. It's a journey. We're still lobbying. In fact, we're finding we have to lobby ourselves, civil society, everybody to get us to that point where we can say it's okay for everybody to bring a dish to the table so that we can have a good meal. So yeah, I think really the take from this for us would be we need to not wait for conferences and events to have this conversation, because I find we always say the good things here. And because maybe we've not met physically for so long, we've not held each other accountable for those conversations when we've met this time. We also, like I've said, need to collaborate more as private sector with private sector to push for government acceptance. And I think, like I said, the grassroots buy-in for me is important, because as we go out as UHF, we find there is a lot of that mindset hurdle that we really need to get over. So for me, those are the things that we need to really focus on.
All right, thank you. I wish time could be able to allow us to continue up until in the night, but we need to conclude this. A special thank you to you, Danny. Those were brilliant ideas coming through, and Grace. A round of applause to our panelists here. And I will also allow you to just take your leave, Danny and Grace. Thank you so much. That was brilliant. I know many of these are captured and they will definitely be disseminated and we'll be able to receive copies. I love when Grace says it shouldn't wait for such conferences. We shouldn't wait to have such beautiful discussions, but also be able to hold ourselves accountable. Some of the key aspects that did come through is the need to start. On many of the discussions that we have, the need to start is key. But also I love one that came in from the audience, the need to integrate our reporting, the private and government reporting, public and private reporting on the healthcare services that are provided. I think that then gives better statistics at the end of the day. Then issues of technological adaptation, the aspects of cost of electricity, cost of gadgets and reliability, a good one to go with, but carefully as well. We need to treat that part very, very carefully. The missing voice of the money people, the financiers, the investors who are going to give us the money, I think that is key to pay attention to. But two other aspects also on a lot of multi-sectoral approach that is needed, especially in the preventive healthcare discussions. Yes, the antimicrobial resistance discussion has been on for a while, and I think in the next few, it might be the biggest killer. By the way, I think all over the last week, we've been reporting about drug-resistant tuberculosis in the northern Uganda and West Nile parts, but it's all coming from issues of self-diagnosis because Google is your friend. We made Google our friend. We're getting all these discussions and self-medicating. So that's all we could have time for. Thank you so much, ladies and gentlemen, for coming through. I think I cannot close the session chair. I will have to invite back Esther to just say her parting shots and see us off. I remain Mildred Tuhaise. Thank you so much for giving me the audience. God bless you, and Johnny Masters as you go back.
A better hand clap for Mildred. I'd already said my goodbyes, but there's a tribe in Uganda, they call them the Basoga. They have a saying that if you don't respect your elders, you die quickly. So Mildred summoned me to come back. I had to do exactly that. But so thank you so much on behalf of PATH. We really want to appreciate you all for participating and staying on. It's now coming to, it's past 6 already, but you've remained engaged. So thank you so much. We really appreciate you and see you tomorrow. Okay, and yeah, before you give me the hand clap, I've been told that there's tea downstairs. So please, you've earned yourselves a cup of tea at our cost or at your cost. Whatever the tea is downstairs, please go and enjoy that. Thank you so much and see you all tomorrow.